Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about longevity's golden rule. Don't do anything stupid. Number one, smoking, igniting your own decline. Smoking, cigarettes, vapes, etc., is strongly linked to lung cancer, heart disease, stroke, and chronic respiratory conditions. It is the classic avoidable risk. Quitting smoking at age 30 avoids almost all the excess mortality risk associated with persistent smoking. Even quitting at age 50 can gain about 6 years of life expectancy. The body is highly resilient if you remove the poison. Number two, excessive alcohol consumption, the heavy drinker's tax. Chronic or heavy alcohol consumption causes liver cirrhosis, heart problems like atrial fibrillation, certain cancers, mouth, throat, breast, and accelerated cognitive decline. Recent, more controlled studies suggest that for longevity, there are no observable health benefits to any amount of alcohol, directly contradicting the popular belief that one glass of red wine is universally protective. Risks accelerate rapidly, even above moderate levels. Number three, reckless behavior, immediate unnecessary risk. Engaging in avoidable high-risk activities, such as driving under the influence, ignoring safety warnings, or neglecting fall prevention, especially important as we age. Accidents and injuries, which are often the most immediate and tragic threats to lifespan. Falls are a leading cause of fatal injury for older adults. For men aged 15 to 20 involved in fatal crashes in 2023, 37% were driving while speeding. Recklessness disproportionately affects young lives while neglecting simple safety, like handrails, is lethal in later years. Number four, poor diet and nutrition, accelerating cellular aging. Consuming excessive processed foods, sugar, and unhealthy fats drives chronic inflammation, obesity, type 2 diabetes, and cardiovascular disease. Consuming a diet high in ultra-processed foods, such as packaged snacks, frozen meals, sugary drinks, is associated with an accelerated biological age, meaning your body's cells are aging faster than your chronological years. Number five, physical inactivity, the new smoking. Living a sedentary lifestyle and failing to break up long periods of sitting throughout the day is an independent risk factor for heart disease, diabetes, and premature death. Even if you meet daily exercise goals, it slows metabolism. Research in the 1950s found that London bus drivers who sat for 90% of their shifts were twice as likely to suffer heart attacks compared to their conductor colleagues who were constantly moving up and down stairs. Number six, chronic sleep deprivation, sabotaging your system. Consistently getting less than 7 to 8 hours of quality sleep per night damages hormone balance, cognitive health, and immune function. Chronic sleep disruption not only weakens your immune system, but can also cause long-lasting, permanent changes to the DNA structure inside your immune stem cells, increasing susceptibility to inflammation and disease that sleep recovery cannot fully reverse. Number seven, neglecting mental health and stress, the hidden epidemic. Allowing chronic unmanaged stress, anxiety, and social isolation to dominate your life increases stress hormones, which may damage the cardiovascular system. Loneliness is a powerful physiological stressor. Lack of social connection, loneliness, and social isolation increases health risks as much as smoking 15 cigarettes a day, making it twice as harmful to health as obesity. Number 8, ignoring prevention and warning signs. The procrastination trap. Skipping recommended checkups, cancer screenings, and failing to seek medical help for persistent unusual symptoms misses the critical window for early detection, which often turns treatable conditions into life-threatening emergencies. The survival rate for stage 1 breast cancer is over 99%. However, approximately 20 to 25% of women who die from breast cancer each year did so not because they skipped the initial screening, but because they failed to get adequate follow-up or treatment after an abnormal result. Early action is everything. Thanks for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you so much.